Perfect. So first of all, good morning, everyone. We are very excited to be here for this session. And I would like to thank the organizers for inviting us today and giving us the opportunity to introduce our team from EIT Health Ireland-UK. So mainly what I want to share in this 15 minutes today, because it's the opportunities that you can find in the EIT Health in general, because, I'm gonna summarize a bit since there is no time for more, but I leave my contact here in case you have any questions, doubts, or want more information about any of the programs that I'm going to detail in a bit. So please don't hesitate to contact us. So I'm going to start by explaining where EIT Health comes from and what we do. I know that many of you already know us, but for those who don't, the EIT Health belongs to the EIT, which is the European Institute of Innovation and Technology. Specifically, we are working in the health sector. And the EIT Health was established in 2015 to solve some of the biggest health challenges. Here in this slide, you can see our vision to empower citizens to protect their own health by improving healthcare systems through advances in education and technology. And our mission that is being Europe's leading health innovation network by 2030, facilitating longer, healthier lives and more sustainable health system. So vision and missions are aligned with our main objectives, of course, that are strengthening health systems at the European level, contributing to a sustainable health economy in Europe by creating new jobs, and bringing innovative products and services to the market. EIT Health is located at the European level in different countries. Our structure is through regional innovation hubs. Here you can see the different hubs that we have. We have hubs in Scandinavia, Germany, France, Austria, Spain, and we have two InnoStarts, which includes several countries from different parts of Europe, and corresponds here the pink dots that you can see in the map. And I also want to comment that the EIT Health headquarters are based in Munich in Germany. So now I'm delighted to introduce here my colleagues from the EIT Health Ireland-UK. This last year has been a year of transition and changes, and the team has been reinforced with new and recent incorporations, with the aim of having experts in each of the areas that are key to the development of our objectives. So this is the team, and you have all our contacts on our website. And here in this presentation, I also leave you the emails of some of us. And what do we do? Well, our greatest value as EIT Health is undoubtedly the network that has been created, formed by different partners as a partnership where many public and private entities, universities, research centers, industry hospitals, etc., have joined us. So what we do is bring together all these fundamental actors to drive this change in the health system and bring new innovations, new product, service to the market, uniting all the actors in the value chain. So I want to talk a bit about our main approach. Our approach is focused on this triangle that you can see in the screen. We name it the triangle of knowledge, which it has its three vertices that are research, business, and education. So you will see that all our activities and programs take this triangle into account, and it's very present in everything we do, because we really believe that this is the really way to promote real changes. For example, education skills are the basis for developing research and reach the business sector. And at the same time, the business skills are necessary in the education sector to develop innovative research. So I'm sure that you agree with me with this, that everything must be connected in the entire ecosystem. And this is our main approach here in the EIT Health. And following this approach and this triangle of knowledge, our programs are divided in three main pillars. We have the innovation pillar, which is for promote these new solutions to the market. and change the shape of health system to make them more efficient. We have the acceleration program pillar that shortens the time to market for entrepreneurs, startups, and SMEs, while creating new jobs and contributing to a thriving health economy. And the education pillar that engage learners across, well, all the society, since citizens to healthcare professionals. Now I would like to present, after this introduction of the EIT Health, I would like to present the programs that we are going to open soon or that are open already. So here in this slide, I like to share with you this open call in the education pillar, which is the Higher Education Institute initiative, which helps these higher education institutions to promote the capacity for technological innovation and entrepreneurship. There are a series of requirements, like, for example, 3 or more European countries have to be involved. But anyway, you have here, I left the link here in the slide, so you can find all the information about it right here. And relating with this, I like to highlight here one successful example that we had on this call. The National University of Ireland, Galway. This university won 1.2 million euros in funding under this program with a pilot project named Idea to Impact, addressing capacity and capability to foster entrepreneurial thinking and actions. So in this case, if you are a university, if you are a higher education institution and you have ideas, projects that can fit on this call, I really encourage you to look in our website about the requirements, and having in mind that the deadline for this call is going to be the 28th of February, 2022. Here we have some other calls for the education pillar programs. We have summer schools and I-Days that have been developed during this year, and the next calls will be launched soon for 2022. We also have boot camps and lively fellowships, which we also have the information available during the first quarter of 2022. And we are working on it because we are at the end of the year and we are working in the final details of all the programs and calls that we have. But for more information on this education pillar and calls, and be aware of the main deadlines, of course, please contact my colleagues that are Graham Hermitage, Collaboration Lead, and David Pollard, Education Lead. Then for the acceleration pillar, I like to mention that we have 2 stages through the year. We have different calls, events, and courses that are coming, and we are currently working on it. We have calls for develop programs like more idea formation that we are going to expect it in January 2022. And then we have programs for companies to participate in the programs that have been created during this idea formation stage, and it's to be announced by maybe at the end of the first quarter or beginning of the second quarter of 2022. We're going to have more details about this. But as you can see here, all the calls on this pillar are related with the access to knowledge, access to market, access to stakeholders, and access to investors. For entrepreneurial experts and for startups. So we have trainings such as mentoring, coaching network, bootcamps activities. We have Bridget Head activity that is related with access to market. And well, we have the EIT Health Catapult, and then we have for investors, we have a wildcard or crowdfunding and investor networks. So what I would like to share here are some success stories. For example, with the EIT Health Catapult program that are opening in January, okay, 5 Ireland-UK startups reached the final stage on this program, and they have secured a place in the finals at the EIT Health Summit 2022, that is going to be in May in Stockholm, in Sweden, and where they will go head-to-head to their share of the 200,000 euros investment prize fund. And another case, and I want to share, is about our Gold Track Accelerator programs. that has led to companies raising over 250 million and achieving 4 exits, totaling over 1 billion euros. And now I would like to talk about the new call for the innovation pillar. This call will be launched in April 2022. And what kind of projects do we have here? No? We are looking for projects that are not just research projects. We are looking for projects in advanced phases and close to the market. So we are looking for new products and services, whether if they are medical devices, digital health, or biotechnology for diagnosis, or two related with how to restructure the existing to improve health systems. And this is linked to reforming health system to make them more resilient and more effective and efficient. So how do we identify that the project is not a research project? Well, we have here the innovation cycle that you can see here in this slide, in which you can see that there are 4 different dimensions that we are taking into account. Technology, regulatory, market business, and clinical. So technology and technology readiness levels, of course, we are looking here for high TRLs. But also we need regulatory, business and market and clinical level should be advanced in this cycle. So in this way, our objective will be to continue advancing in these 4 dimensions, and in this way, we can have the solution on the market as soon as possible. It's important to note that they are collaborative projects with consortiums from different institutions and at the European level, of course. For you to have a guiding idea, these projects are normally financed with 2.5 million euros per consortium, representing the 70% financing of the total activity. And in previous calls, they were 3-year projects. But at this moment, as I say, we are working and defining all the details. So it's important to highlight that there may be some changes in this call. But soon we are going to have more details about this new and exciting call. Yes, and up to here, this is what I prepared for today. And I leave you here my contact and my email. And I also leave you the link to our social media and networks. On our website, you have all the information available about our programs. All the information related to the new calls will be available for sure at the end of December. And also here, I put the link in case you want to subscribe to our newsletter, because we are going to be periodically communicating all the news, deadlines, calls, and everything that is important to have in mind. And yes, thank you very much for being here today, and thank you very much for your attention. Thanks.